I have heard a lot of talks about pain and the specific points that are very important in relieving pain. We'll shift gear a little bit. We look at hypertension, and we will talk about hypertension. And hypertension is multifactorial, meaning many factors can cause hypertension or a combination of that. And many of them end up being influencing the sympathetic tone or sympathetic activity. For instance, we know that aging, the angiotensin hormonal system, obesity, sleep apnea, they all in one way or another influence the sympathetic system, and eventually we develop hypertension or essential hypertension because we cannot pinpoint as to what the cause or the causes may be. We have demonstrated in a number of studies that electroacupuncture at the specific points overlaying the specific somatosensory nerves, it actually can decrease the sympathoexcitation or over-excitation. So it influences the autonomic nervous system. And we have shown with different models. We have shown it with reflex models as well as sustained hypertensive models. In the reflex models, what we did in the number of years ago, we looked at if we excite the system, we excite the sympathetic activity, therefore increasing blood pressure, can acupuncture reduce that sympathoexcitation and hence decrease blood pressure? So we use models such as the visceral reflex responses, the exercise reflex responses in human. We also have looked at the parasympathetic system, whereby we induce a decrease in blood pressure and a decrease in heart rate. And we saw that acupuncture can reverse that as well. So then translationally, we look at, well, the points that we have identified that influences the autonomic nervous system or the blood pressure regulation, can that be used in humans who are mild to moderate hypertensive? So before we dive into the human data, let's look at how acupuncture actually can reduce the sympathetic activity. So we have shown that if we stimulate these points and we see that somatosensory input ascends into a different area in the brain, the peripheral stimulation, there is a inherent central processing and a number of very specific neurotransmitter systems are turned on during the acupuncture stimulation in the different areas of the brain, such as in the hypothalamus, in the midbrain, and the brainstem, such as in the medulla. Let's see. And so we have a list of neurotransmitters that are important. And as the descending pathway after the central processing has occurred, we then notice that the outflow in the condition of hypertension, that outflow now is reduced after acupuncture treatment. So we have looked at the neuronal pathway during acupuncture stimulation. So we looked at the peripheral sites, so the site of the acupoints. We have used manual acupuncture, electroacupuncture, as well as moxibustion. We noticed that the reflex responses, the final outcome, is similarly reduced. We also have looked at the dorsal root ganglion, and then look at the different areas in the brain, such as the hypothalamus, midbrain, all the way down to the spinal cord. So the models that we have used is we induce a repeated stimulation, and we notice consistent increases in blood pressure. When we apply acupuncture, electroacupuncture, there's a reduction in that sympathoexcitatory response. And we see the same similar outcome when we apply manual acupuncture. But we don't know if the mechanisms are the same or not. So we went on and we tested in a similar model. So we see that if we stimulate repeatedly the sympathoexcitatory system, there's an increase in blood pressure. During acupuncture, we see there's a decrease in that decrease in that pressure response. And when we block the TRPV1 receptors, we see that there's a reduction in that acupuncture effect. And this one is the vehicle of that blocker. So what happens when we similarly use that blockade in an acupuncture-treated animal? We do not see that reversal. So we concluded, or at least we suggest, that the TRPV1 system is relevant to manual acupuncture, however, not in electroacupuncture in our cardiovascular system. We have used neuronal activity to further demonstrate that TRPV1 is important in the neuronal activity. Here, we look at manual acupuncture stimulating the median nerve. Here's the vehicle, and we see similar response. When we block it, after the blockade, that stimulation of action potentials, the number of action potentials are reduced. Here are bar histograms, which is a summary of that. Compared to electroacupuncture, before and after, very similar response. Manual acupuncture is significantly reduced after the blockade. We then went on and we looked at the dorsal root ganglion, and we knocked down the TRPV1 in the DRG, or the dorsal root ganglia. And we noticed that the TRPV1 expression is reduced, which is the black bars. The hatch bars is the scramble or the control of the injection of siRNA. And when we measure for the activation in the DRG, we noticed that animals that are treated with manual acupuncture, activation is reduced. However, the activation stayed the same or similar in the electroacupuncture treated animals. And these are the Western blots raw data. So in other words, in peripheral nervous system, in the DRG, decreased TRPV1 expression leads to decreased DRG cellular activation during manual acupuncture, but we did not observe that in electroacupuncture. So now that we have looked at manual acupuncture and electroacupuncture, we wanted to see what happened to the thermal stimulation, to moxibustion. So we used the same pressure response model, excitation of the sympathetic system. And when we applied it 1 centimeter away from the skin of the rat, we noticed that there is a reduction of that sympathoexcitatory response. However, when we removed it at about 2 centimeters away from the surface of the skin, there was no effect in reducing the pressure responses. We went on and applied it on a G39 acupoint. We wanted to see, is it point specific or was it just heat sensitive? There's no response. Then we applied it with electroacupuncture at the same point. So there's also no response, no inhibitory response. So then we looked at, well, with moxibustion, is TRPV1 equally important? So we blocked it, and you see that there's a reversal of that, very similar to the MA response. In the DMSO or the vehicle, there was no reversal. In acupuncture, there's also no reversal. So in conclusion, we suggested that manual acupuncture and moxibustion seems to use the TRPV1, except that manual acupuncture likely uses the mechanical sensitivity of TRPV1, while moxibustion uses the heat-sensitive region of the TRPV1. So then we looked at, okay, so peripherally, there are differences in the different modality of stimulating the acupuncture point. So what happens in the brain? So we looked at the PVN, if you recall this diagram. We looked at the PVN and see how it influences sympathetic outflow, which is at the RVLM that then influence the outflow to the target organs. When we block the opioid receptors in the hypothalamus, we notice that that reversal is observed again. And with electroacupuncture at P5, P6, where we similarly block the opioid receptors in the PVN, we also saw a reversal of that. So it looks like that the hypothalamus it's involved in electroacupuncture as well as moxibustion. Okay, so now that we know certain areas are in play, certain neurotransmitters are in play, what are the neuronal pathways or the different regions that are connected to each other playing a role in the actions of electroacupuncture? So for instance, there are many, but just for time, for the constraint of times, we look at PVN and RVLM because the RVLM is really important in determining the sympathetic outflow. So if sympathetic activity is increased and when acupuncture or moxibustion or manual acupuncture is applied, does that outflow decreases to decrease blood pressure? So to do that, we look at the different connections, and I'm just going to give you like one of them in how we have tested it. We have used antidromic stimulation, which is a functional approach of looking at whether the connection between the PVN and the hypothalamus is one neuron that dives down to the RVLM. So this is a functional way of measuring that. And we can talk more about this if anyone is interested, but that's one way of testing it. In an anatomical way, we inject a dye into the RVLM, and then we see that that dye is being picked up and it is then visible in the PVN neurons. So we notice that the neurons that are projecting downward ends up in the RVLM, at least that's one site, and that these neurons are localized or contain the opioids, which indeed you see that merging of the retrograde dye as well as the opioid. And the opioid, in addition to adenosine, has been always very much known and related to the effects of acupuncture. So functionally, we look at, okay, so we know this pathway is involved because all these neurons are being tested, whether it receives acupuncture input as well as the sympathetic input. So when we induce suppressive responses and we see repeated consistent responses, and we give acupuncture, we see that there's a reduction. So after we have noticed that there's this direct projection, and we give electroacupuncture, we notice then that that descending pathway is reduced in its activity. And then, so we notice that when we record the neurons during acupuncture, there's a reduction of the number of action potentials. And then when we block it with the naloxone, the opioid blocker, we notice that the neuronal activity is reverse its inhibition by electroacupuncture. So now that we kind of have gone through all the central processing and the pathways and so on, then we ask ourselves the question, when we turn off acupuncture, does that effect stay on? Is it a long-lasting effect? So these are all anesthetized animals, and we recorded the neurons, and we see this similar profile with blood pressure changes. Recordings, we have then blocked it, and we also saw that the neuronal activity is reversed. The acupuncture inhibition is reversed after the blockade. So then we have used all this wealth of knowledge and findings, and we have translated into our mild to moderate hypertensive study population. And we see that when we use similar acupuncture point that we have looked at, that it actually decreases the peak systolic blood pressure, the average, here we have the diastolic blood pressure, in contrast to points that are actually what we have used it as the control points, and we don't see a significant decrease in the blood pressures. Oops, sorry, this one. So as with everything else, we have a group of patients, about 70%, that are really well responsive. And we notice that in these patients, they display a much greater decrease in the systolic blood pressures, in the peak as well as the average blood pressures. And then in the small group, we have looked at after the 8 weeks of therapy, when we ask them to come back once a week and we treat them once a week, and we notice that the blood pressure stay low or it dips down a little bit lower. But this is in a very small subgroup, and so we continue to look into this and see if it holds. So what we have seen is that, okay, so sympathoexcitation linked with high blood pressure, does the norepinephrine in these patients dropped after acupuncture stimulation? And we noticed that in the patients who respond quite well, the norepinephrine has dropped after the treatment. However, in the patients who do not respond as well, there is no change. Now that's a very interesting question, and definitely more studies are warranted. So from that population study, I've noticed that we have a few younger than middle age, men and women. We have the males, middle age and older, and the females, middle age and older. And we noticed that there are way fewer females that are responsive than the middle-aged men. And so 27% are non-responders in the female, while there are only 9% in the male. Currently, we are looking into this particular feature, and we are designing targeted points. So most likely we have the aging process. We have in female the menopausal issues linked to it. So we are actually looking into how can we address these physiological systems to help these folks to reduce the blood pressures. So we believe that when we say that acupuncture is not 100% effective, that perhaps we have to really subgroup and look at our population much closer, gender, age, maybe pre-existing conditions, and see what are the differences and why is it that they are not responsive to our treatments. And my acknowledgement to our team. These are long-standing collaborators for well over 20 years, and with whom I have worked closely with. And many of you may know about Dr. Longhurst, who just recently has passed in an accident. And he and Dr. Peng Li has been the leader in these studies for many years. And so many thanks to our team. And this is really a collaborative effort on all these different data that I have presented today. Thank you.